Joint replacement and repair is an opportunity. It's an opportunity for you to look at this as a step forward, not a setback. Have you ever wondered what it would be like to eat in a way that aligns with your goals for health, well-being, self-care? Do you even have goals in these areas? If not, now is the perfect opportunity to set some. Joint replacement and repair is a great opportunity not only for renewed mobility, but also renewed health. Being nutritionally fit going into surgery of any kind can help improve the quality and rate of your recovery. It can also reduce your risk of infection and being readmitted to the hospital after the surgery. What does it mean to be nutritionally fit? It means you're working towards achieving a healthy body weight and getting stronger. It means that your blood sugar is well balanced. And it means that your tank is full of nutrients versus deficient. I'm Tara, your Ortho nutrition dietitian, and I'm here to tell you that joint replacement and repair is a great time to ensure that you are eating a sufficient number and amount of nutrients. Micronutrients in particular are what we're going to talk about today. Micronutrients are small nutrients with a big impact, and a variety of healthy foods and balanced eating, like you see here on this plate, are helpful in meeting your minimum daily requirements. So meeting your minimum daily requirements is really as simple as picturing a plate. That's how you can help to ensure you're getting enough of the vitamins and minerals without having to overthink it or stress about it. Start with this foundation, incorporating a variety of colors, flavors, and textures into your plate. With half the plate coming from vegetables, a quarter of the plate coming from a carbohydrate, another quarter coming from protein, and then drizzling it with healthy fats, a side of water, and top it off with a sweet treat of fresh fruit. Surgery and recovering from orthopedic injury requires certain vitamins and minerals very specifically. Muscles, bones, tendons, ligaments, cartilage, soft tissue, connective tissue like the skin, all require micronutrients to recover, rebuild, and repair. And it's a complicated system of structures going on to rebuild that tissue and reconnect it. Which are the most important micronutrients to focus on after surgery? All the micronutrients are really important, but there are some that need specific attention, and those are the ones we're going to go over next. Vitamin C and D and minerals zinc, calcium, and magnesium are those that I'm going to pay specific attention to in this video. You want to go into surgery being fully sufficient, having full levels of these vitamins and minerals loaded into your body. How do you ensure you aren't deficient? Well, it starts with a food-first approach, not a lot of stress. So a food-first approach is eating that balanced plate and striving to do that 70 to 80% of the time, 3 times a day. Supplements can provide a necessary boost, but they can't do all of the heavy lifting all on their own. Opt to get most of your nutrients from that balanced plate and a varied diet. Are there nutrients needed in higher dosages to help heal after surgery? Yes, those I mentioned. C, D, zinc, calcium may need to be supplemented to meet your daily needs. So 50% of your plate coming from vegetables is a good way to ensure you're getting a lot of those minerals. This is just a reminder that a variety of color, taste, and texture is really important to that micronutrient foundation. 5 or more servings of vegetables delivers loads of micronutrients. I will be focusing on nutrients important to healing bone and other tissues. Vitamin C is very important to tissue repair. Maintaining a circulating level of vitamin C in the bloodstream can be done by eating 5 servings of vegetables and 3 servings of fruit each day. What if you don't eat that every day? Well, you can safely supplement to the limits of your digestive system, which is up to around 2,000 milligrams. However, for wound healing, you only really need 500 milligrams per day, and that is more than the RDA, which is 75 to 95 milligrams per day, depending on whether you're a man or a woman. But again, post-op, for that 1 to 2 weeks, you want to ensure you're getting 500 milligrams per day, which you can get from your food. If you have a limited appetite, you may be limiting the intake of your vitamin C, so you might need a supplement. Vitamin D is known as the sunshine vitamin, and it's critically important to not be deficient in vitamin D going into your surgery. How do you ensure you're getting enough vitamin D and not deficient? Well, it starts by testing. Don't supplement before testing. Ask your doctor to do a blood test of 25-hydroxy-D and that will give you an indication of how much circulating vitamin D you have in your bloodstream. Focus on getting 3 servings of dairy or calcium fortified foods each day. In addition to that, if your level of vitamin D is less than 35, you can supplement with vitamin D3 at about 1,000 to 5,000 international units, or IUs. Zinc is needed for more than 200 different enzymatic functions in your body. When you don't get enough zinc, immune function, collagen production, and cell and tissue repair is lowered. What food sources contain zinc? Sources of zinc include meat, seafoods, eggs. Those are the animal sources. If you're not getting a lot of those in your diet, you may need a supplement. You can also get zinc from grains and legumes, but there's a compound in there called phytate that can interfere with the absorption, so you're not getting a whole lot of zinc from those foods. If you're a vegetarian or you limit intake of meat, seafood, and eggs, a supplement is a good idea. How much zinc is needed after surgery? Meeting the RDA, if you eat animal protein, like I said, is pretty easy. If you follow a vegan diet or a diet that is high in grains and legumes, a supplement is recommended. And you don't need to supplement more than the RDA. The RDA for women is 8 milligrams and the RDA for men is 11 milligrams. Calcium is the next mineral that's really important in repairing after surgery, especially if you have surgery or injury to bone. Calcium is critical for bone formation, and sources of calcium come from dairy, milk, yogurt, cheese, cottage cheese. You can also get calcium from leafy greens like kale. You can get it from broccoli, soybeans, tofu. Those dark leafy greens also are rich in calcium. 1,200 milligrams per day is the RDA for calcium, and you need about 2,000 milligrams a day after surgery for at least the next 6 weeks. So you may need to supplement if you're not getting 3 servings of dairy each day. Magnesium is a very trendy mineral right now, and for good reasons. It's an important mineral when it comes to healing and muscle function, and we really do have limited food sources of magnesium. What foods have magnesium? Sources of magnesium include whole grains, spinach, almonds, greens, avocados, and beans. To meet your magnesium needs, you need to eat multiple servings of these foods each day. If your diet is rich in these foods, a supplement isn't really necessary. But taking a supplement of 200 to 400 milligrams per day can be good insurance when greens, grains, and beans are lacking in your diet. Ensuring you get the nutrients you need can help improve healing and lower your risk of infection, and it can be very challenging. Adopting a food-first approach and doing the best you can is really good enough. I do recommend supplementing with fortified shakes and replacements leading up to surgery and the week after surgery. That is why at your pre-op appointment before your surgery, you will be given a nutrient-dense supplement powder. You can mix into liquids and other foods, and the recommendation is to have this packet twice a day, the week before surgery and the following week after surgery. We have more information about food and nutrition, diet than ever before. Yet we still struggle to be fully nourished. What's getting in the way? Well, it can be loss of motivation in the face of junk food. It can be lack of self-acceptance, just simply starting where we are. It can be our mindset, fear of failure, perfectionism, self-sabotage. It can also be stress and fatigue. Here are a few strategies you can adopt as you begin the journey of self-care through nourishing foods. 1. Accept progress over perfection. Strive for a healthy eating pattern 70 to 80% of the time each week. Identify your why. When motivation is gone, this why is something that you can go back to. Like, your why may be the ability to take walks in nature, or ski, or play with your kids, or participate in different athletics. Number 3, identify fears and patterns around food by pausing before you take a bite and ask yourself, why am I eating this? Is this to help me build, repair, recover, fuel? Or is it simply for pleasure? There's no wrong answer. It's just noticing what you're eating and why you're eating it. Number 4, make balanced eating routine by not skipping meals and nourishing your body instead of starving it or depriving it. These are just a few things aside from what to eat that we go over in our Ortho Nutrition Lunch Hour each week. Each week, the orthopedic department at Tahoe Forest offers a nutrition lunch hour. If you're interested in learning more about what to eat to come back better and stronger after your surgery or an orthopedic injury, you can join us at 11:30 to 12:30 every Wednesday on Zoom. We'll talk about preserving and building muscle, promoting wound healing, supporting your bone health, and enhancing your immune system. You can call Tahoe Forest Center for Health at the number on the screen. Thanks for watching and hope to see you there.